more balanced. But I don't like to say the word balance because it's more than balance,
Okay,
but optimized.
optimized, more than balanced. They're
Mm,
optimized.
mm, yeah.
Um, yeah, that's true because it's part of the equation. The joints are there,
Mm,
and people normally it's not the first thing they focus on. And I heard throughout my life several times, oh, the joints are inflamed, right? That's a thing.
mm, mm-hmm.
So
Yeah.
yeah, go ahead.
Yeah. And so, so if you are, if the joint is in balance, then the one there are a couple of systems that follow the skeletal system, and they could be compromised in
Mm,
terms of removing excess inflammation fluids,
mm,
etc. Because if the knee mechanism is being pulled to the inside of your knee cavity, and it's always for most people it's often bent, so the back of the knee is always compressed.
mm,
Um, so so that pathway for the optimal pathway for the fluid for the inflammatory fluids to move through the joint um, is compromised. Yeah, you can put ice on it, or you can put your legs up in the air, and it helps a little bit. But again, you know, um, you know, like when I had my really complex ACL, PCL, MCL surgery.
oh, what is that?
Uh, so that's three ligaments around the knee. So you often hear of an athlete having an ACL injury, um, but I had three of the ligaments. There are four ligaments in the knee,
Mm,
um, and so when I had that done the second time to the same knee, um, because of the techniques that I was um, complementing my rehab program with, um, my orthopedic surgeon is on the who's on the same sports med team as I don't know if you know the Patriots. Do you know the New England Patriots?
I
Tom
I
Tom
heard before.
yeah, Tom Brady. You
Oh,
may have heard of.
I know that name, but I never I heard it from like I know
He's
it's
a
famous.
in America. He's a legend. So
Right on.
he won lots of championships, and to be playing at an elite level American football, I don't know what age he retired, but he had to be. It was like in his early 40s. He was still playing at the elite level. But anyway, he had um, a simpler ACL surgery, so just one ligament, and he was able to do rehab straight from the get go. Whereas when I had my three ligaments, not only did I have three ligaments, for a month later, I had to have back of the knee surgery. So when you have ACL,
Oh my god.
um, when you have an ACL, front of the knee um, operation, they want you to be doing flexion exercises as soon as possible,
Mm-hmm,
you
mm-hmm.
know, bend the knee and all that sort of stuff. But because I had to have back of the knee surgery, so then my leg had to be in extension for a month
Oh my
whilst
gosh.
and so then all that scar tissue from three ligament surgeries was being, had time to thrive on there. And so I'm walking with an extended leg rather than be focusing on trying to, do the flexion exercises. So when the brace came off, so I was not only was I a month, now 2 months behind, just a simple ACL surgery, but then I had all that scar tissue as well. So that was an added complex, um, uh, you know, there was a more complexity added to my surgery. But at 2 months, our mutual orthopedic surgeon said that I was 2 months, no, not 2 months. At 2 months, he said that I was 6 months ahead of his professional athletes. And I asked, is Tom Brady one of your athletes? And he was like, yeah, he just like nodded. Because he's, so, but, to think about it, I can't work on my knee 24/7. I'm not paid to work and do, I don't have hands-on therapists. I don't, I can't go into a hyperbaric chamber or, you know, ice bath, cold bath, red light, whatever it is, all the latest, for him, that which are kind of common, not common yet, they're not common, but they're getting more mainstream. But for him back then, all those really expensive treatments he's doing 24/7.
Hmm.
I'm I don't have those resources. I don't have that time. I go to physical therapy 2 times, maybe 2 times a week, maybe 3 times a week at the beginning of my physical therapy session. But what I am doing is I'm doing the exercises which the physical therapist is doing, but they lack so much bone intelligence, even though they're telling me to level my hip bone or level my shoulders, or it really is, that's just very, you know, bone technology basic. So it's not even basics. I don't know, but it's just very simplified. Like to go inside, like when they give me an exercise and my knee is hurting because of the way they're coaching the exercise, and I know which side of my foot to do to lift my knee up. I know which side of my knee joint to move because the knee mechanism is collapsing. I know what to do in my hip joint area to create sustainable um, protection for my knee whilst I do the exercise that the physical therapist has given me. And they're just telling me to do reps. They give me some base. If you think about it, if you've been to PT, they just tell you to do 10 reps of
Hmm.
this
Hmm.
exercise, which is so goddamn boring, etc. Which you do because you have that injury and you want to, the muscles have atrophied and you want to slowly grow them. Um, but there's no critical thinking involved in the whole process. Whereas I'm critically thinking, I'm through every phase of the movement from you know from contraction to release. It is a little bit like doing. Have you ever done weight exercises really slowly?
Oh yeah, it's
Like,
painful because it's heavy.
yeah,
Yeah.
it's hard work. So I'm doing that not only uh, on the contraction, but on the extension too. Right to the and like taking a weight to the full extension.
Mm.
Yeah, because most people just go like you know
They go as fast as they
past,
can. They just want to get over
yeah.
with it. Yeah, yeah.
Yeah, and so when you do an exercise slowly, but also do it slowly with skeletal intelligence, it's a completely different way because it makes really boring exercises actually quite interesting because you really are checking in at every like micro second where the bone and the joint is, and when you feel that twinge because you know what to adjust in your hand, what to adjust in your shoulder, and you just go through the movement with such curiosity. Well, that's what I think anyway. That's why I hope the athletes and anyone who's in physical therapy, they become hyper curious about what their body is doing at any given moment.
Yeah,
So
but I mean,
anyway.
those athletes, they should be hyper curious as well. I mean, if you were able to recover 6 months faster than Tom Brady, that's something. There's some knowledge there. Like they should better pay attention. Um, so if
You'd
interested,
like to think.
go ahead, go ahead. Oh yeah, you'd like to
You'd like
think, yeah.
Yeah, but then, because sometimes when you are talented, you don't think you need to learn anymore, or that you have the team around you that that can that are giving you the exercises and the way to look at skill development or recovery um, in a you know with the most amount of latest um, technology and education and experience. But so sometimes there's a reliance on um, existing paradigms that gets in the way, or or no, existing talent. And although a lot of people say that um, they have a growth mindset and that they are never-ending learners, sometimes they just can't be bothered. I can't be bothered to learn another thing.
But my assumption is like those guys, the top players, right? They already have their system in place. They have all those other coaches. They know they're doing, so they don't even need to question it. They just go with the flow, you know. And same with that. That's just an assumption, right? And even the coaches and the people around the top players, they already learned their thing at university or whatever, and they're applying, you know. And then comes someone else. Oh, but you need to pay attention to the bone. I was like, uh, lady, let me do my job. You know, like they're not bothered. I'm not saying this is the right approach, like because again, I need to stress that if you're able to recover 6 months faster, that's a lot. That's really they should pay attention to that.
Yeah, yeah, I know. And I think part of it for me was it's only been in the last like year or so that I've really been able, that I really was comfortable saying I was a bone hacker,
Mhm.
that I was really comfortable saying that I teach structural, I am your structural engineer. Because I was still, even though I knew, like I have a tagline, check your bones more than your phone, which is what I want people to do. And I wasn't really fully embracing that fully embracing it. So it's only